Hello, this is Dr. Shemen. Today we're going to be discussing sinus issues. Now, the nose is a very important structure. It provides humidification to the air we breathe, it heats the air we breathe, and it filters the air that we breathe. However, a number of conditions can involve the nose and the sinuses, specifically deviated septum and sinusitis. So let's first discuss deviated nasal septum. The septum sits in the middle of the nose, separating the right side from the left side of the nasal cavity. In many patients, this can be deformed from the time of birth or from trauma, such as getting into an accident and traumatizing the nose, as a result of which the nose becomes curved and blocks off the breathing on one side or the other, or even both. The surgery to fix the septum involves general anesthesia, and we basically, under that type of anesthesia, are able to carve out the portions that are deviated or reshape the portions that are deviated and put them back into proper positioning, enabling the patient to breathe once again. The side of the nose consists of the turbinates. You have over here the superior, the middle, and the inferior turbinate. These turbinates are most important for, once again, filtering and humidifying the air that we breathe in. Because there's so many convolutions, the air is forced over these areas as it goes down through the back of your nose and into your lungs. And there are many conditions that can involve this area, such as the patient can develop obstruction, which then leads to blockage of the openings of those sinuses. Here's an example of polyps in the nose. And basically these arise from the sinuses and then project into the nasal cavity and prevent that person from breathing clearly. Sinusitis occurs when one of the or more of the sinuses becomes blocked by chronic inflammation. And as a result of that, the pus backs up into that sinus. So here we have the frontal sinuses, these are the maxillary sinuses, and here you can see the sphenoid sinus. The ethmoid sinuses are right over here. Once again, there are 4 sinuses on either side of that nasal septum, on each side of the face. Now, in order to relieve that sinusitis, we have to treat the infection within the sinus, and we have to also reestablish the drainage of that particular sinus. In the office, we can do a number of procedures in order to relieve chronic sinusitis. One procedure that's commonly done today is called balloon sinuplasty, which means that we go in under that middle turbinate and go into the frontal sinus, right up in here, and go into the maxillary sinus and even into the sphenoid sinus and open that drainage path of that particular sinus that's involved. That's an office procedure. The other procedure that we do is using a tip within the turbinate to shrink the size of that turbinate. This over here is what we use in order to do balloon sinuplasty. We go in first with a fine wire, then we introduce the balloon, which we then expand by blowing it up just like a regular balloon, and it will then dilate open that sinus, and it is quite effective. The Celon is the device that we use to shrink the turbinate.